First item on the agenda is public comment. We have a new reporter. Hi, how are you doing?
Hey, how are you guys?
Okay. No public comment. The next item is the consent agenda. Has everyone had a chance to read the minutes? Yeah. Yes. Okay. Any motion here to?
I'll make a motion to approve the minutes as written.
Okay.
Second.
Moved and seconded to approve the minutes and the consent agenda as presented. All those in favor?
Aye.
Passes unanimously. Okay. So, Joey, you're on. Get there quick.
Everyone knows Joey Randall, Cheryl's right-hand man. Cheryl was unable to be here tonight, so we've asked Joey, who's capable, very capable, of sitting in.
Charlie,
Sure.
we have a lady over here that I don't know.
Oh, I'm sorry.
Hello.
Maribel, you want to introduce yourself?
I'm Maribel Den, and I'm the interim director of nursing services for Lakeview Gardens.
Oh, wonderful.
Okay.
I'm Chuck Callis to meet you.
And everyone, does everyone know Arvinder Singh? And I don't think there's any other new faces.
I'm sorry, I was remiss in my duties.
Yes, you were.
I stand corrected.
Set.
Okay. Now, Mr. Randall. All right, Bill.
For the patient counts, we'll see maybe with the year-to-date stuff, but the emergency patients are down for the year. Our outpatient surgeries are up, but with our emergency patients down, we would normally see the increase in the clinic, but with our providers transitioning and stuff, we've lost about 600 or so in the last few months. But it's going back up in May, and we're expecting it to increase back up to normal. Our gross patient charges are up at our highest point this year at $3.36 million, and that's about 13% or $400,000 over our 2018 average.
Is that through June, or is that just through May?
That's just through May. The other 2 years are through June. But we're above average, and it's up and looking good. And our collections are on AR are above average as well at 2.14 million, above our average of 1.9. It's going up. Our days in AR are at, where's it go? Hold on. There we go. 73, which is up 1 day from last month. And it's below our average, but we're working on trying to fix that with RICAN. And Lisa can give us an update on it.
So we've gone live with the scrubber, and we've also gone live with the electronic remits. And it went pretty well. We're still tightening some things up. We're adding some edits, removing some edits. We have a little bit of slowdown with our electronic payments, but I think that's all resolved, so it's looking pretty good. We're just about to go live, well, actually, we're just about to start the implementation for the denials management module and the insurance verification module. So it's going pretty well.
Is that the final implementation, or there's other modules to go on?
There was a total of 5 modules, so we've gotten 2 up and running, so we have 3 more to go. But I think we're going to do 2 of them together at the same time, so I think we have the toughest ones done.
Okay. Thank you.
When do you anticipate doing the next module upgrade or install?
We'll probably start next week with the verification and the denials module. This week, a lot of people at RICAN are out, and so we don't have our next meeting scheduled yet.
So when do we anticipate we will be fully using the product?
We're using the parts that we really, really need, which is the electronic submission and the electronic payments. That's our main ones. And it takes about 4 weeks to implement each module. So if I can do the insurance verification and the denials management together, then it would be another month until those are done. And then the patient liability estimator should be a month after that. So I'd say in 2 more months we'll be all the way done. But the hardest part about doing the implementation really is all of the enrollments with the payers. And that part we got done with the ERAs, the electronic payment portion, and then the claim submission portion. So the next pieces shouldn't be as time consuming because we already have those enrollments in place.
Thank you.
With that, RICAN should help us out here a bit. May, we're at 90 days cash on hand. That's our covenant with our wall-fed loans. So June should be better, and we should be back up above 90 at that point. We haven't checked the numbers yet for June, but we're expecting it to be pretty low.
Good stuff.
So May was better compared to our budget, for our revenue was high, and our expenses were low, so it gives us a nice net gain. If we look at the year-to-date versus budgeted, over on the right, you can see that we're down 2.5 million in our revenue, but that's with, our expenses correlate with that, and we're also down 2.6 million, so budgeting isn't that bad. We just think it is much revenue as we thought, and we didn't expense to do that. And we're looking good, about 355,000 net gain for the year, which is more than we expected. In our balance sheet, there's no significant changes here. Probably some big changes you'll see is with our cash and investments. That's because we drew on our bond, and down in the liabilities, you'll see that pretty much the same increase down there. So there's really no change between the two. Any questions on LHD?
Quiet group tonight. No questions. Pass the first test. Okay. Next item is Goose Lake.
Lakeview Gardens. May patient counts are down along with April, but they're a little bit higher. We got one more patient above than we did in April. May we had 19 patients in long-term care and 5 residents in the out.
Assisted living,
Assisted living, sorry.
just so everyone knows our acronyms.
But when we moved 2 from the long-term care to the assisted living, so that brought our number down a little bit.
So how many are in assisted living right now?
5.
5. Okay. And you're going to move another couple in soon?
We had 5 inquiries last week, and we did 3 tours. So we're hopeful that they will make that transition from home to the assisted.
And he's speaking at Rotary on the 25th.
Okay.
And I'm speaking in Alturas Rotary on the 20th, along with Bodop Medical Center, Cedarville, and the Senior Center.
Okay, good.
In our June numbers, there's 18 in long-term care, and as I said, 5 in assisted living. We'll see the patient numbers, patient count go down.
Larry, when you're down in the 2 units, do you balance those out number of patients, or do you try to have them all out of one, or just however it happens to?
However they happen, we can ask them to move into the other building, but they've been there for almost a year, and we are required to ask them to move, and if they say no, we have to respect that.
Now, if we look at our monthly revenue for May, it's at 190,000, which is a little below average, and that's due to our patient count being down. P&L. Decent revenue, hopefully goes up, and what's really hurting is contract labor, as in most of the time. So we're sitting at 928 loss for the year so far, and in June will probably bring that just over a million. Goose Lake. Our revenue is down a little bit in Goose Lake. Provider down there was on vacation for a week, so our patient counts go down. And it brings us down to a $17,000 loss for Goose Lake for the month of May. And our year-to-date's 233. About where we're at. This is about the transition. So where we're at.
I can tell you that we call the state constantly. We still don't have an answer. It's never seen anything like it. This is the transition to it being
It's been a year and a half now.
Is there,
What happened to our in with the accountants?
she's the one that calls and sits and talks, and
Okay.
she is one of the Western states experts dealing with this. And Ripley is a incredible source to work with the state. When Ripley took over a consulting firm out of the Bay Area, they were the largest group that had handled transitions of rural outcomes in the state. They're also involved. I don't know what we do.
So what are they being told?
They give us all copies of what is being told. We're working on it. You know, this last go-around where we had to send them additional forms, we couldn't find the forms. When you say the state employees are just don't move very fast, it's not an acceptable answer. I don't know what else to do.
would it pay to contact Senator White? Isn't he pretty much into healthcare?
Yeah, but he's Oregon, so I really have to get in with a California legislator that would have a say. Problem that we have is that's Republican territory and very blue Democratic state. So we don't have a lot of leverage from that standpoint.
So Charlie, what is the biggest difference between this time a year ago and this time today? That's a big difference.
Large part is the physician, Dr. Gilbertson, who left. And we've been we brought in some temporary docs, some locum tenens, tried to see if we could get them to stay. We have a commitment for Dr. Foster to go down 1 day a week. So we keep looking for a full-time physician. That's been our biggest problem. We could certainly improve our numbers if we had greater volume, but we have to have doctors. And we've struggled with that. We've interviewed a lot of doctors. We've tried to a lot of people. That's been our problem. So. And it's frustrating when we're told by the state, we should be able, I mean, my goodness, 6 months ago, they said it was approved, right? We were just waiting on the documents getting to us. And they never came. So clearly, they were not telling us the truth. How do we change that? I've offered to go down to their offices. They won't tell me where it is.
So it may never happen.
No, I don't think I would say that.
Well, 2 months
In
ago.
our lifetime.
I missed the last meeting, but 2 months ago, I was under the impression it was going to happen any day.
So what the state employees say is, oh yes, we have everything we need. we promise we'll have it done, and then it doesn't happen. And it's a very frustrating thing when you see people say, oh yes, we'll do it, and then they don't do it. There's no accountability for it.
We don't have a name.
We have a name.
Anybody to talk to.
But they don't seem to have, they claim they have the clout, and then it doesn't happen.
There has to be a reason. Whitley, the gal who's working for us, must have a reason. I think there's got to be a reason. What is it? Something we don't know.
I think it's called ineptitude.
That's not a reason. It's going to happen, they keep telling us. Well,
If you have any suggestions, or have an in with one of the California senators, I'd love to know. But that's, I guess I just have to make it happen. I've got to go down there.
And walk the halls with our
Yeah.
accountant that's helping us there.
Because this is, it's,
Because it's a year and a half now. You know, when we started out, the accrual was, I recall, $267,000, and now it's, months later, it's got to be closing in on $500,000. And as you can see, that would make a big difference.
oh, sure.
So a trip down there for $500,000 might be worth it.
I've offered, I've asked, I can't get an answer. So I'll just make it happen. Next board meeting, I'll go down. I'll find out. It's frustrating, beyond frustrating.
Okay. More comments? No? Okay.
I think the last one is, like a medical supply. They're turning a profit monthly now, steadily. And they had a slow month for May, slower than April, but they're bringing in the money. We have our billing gonna switch over to us soon, hopefully. And we won't have to worry about outside billing.
Are they selling more into Alturas with oxygen?
Not as much as I thought they would, but they're doing more business down there. I think they're going down at least once a week.
Okay.
Any questions on those?
Any questions for Mr. Randall? No? Okay. Next item is capital purchases. Mr. Craig.
Did we send out the capital purchase?
The Phillips, yes.
So,
You did?
you did?
Uh-huh.
I didn't.
I haven't seen it.
Me either.
okay. Then what I can do is hold off with that purchase for a month. This was a request from the physicians to have a handheld ultrasound, small unit that's in the office to help with, we have a couple of ultrasounds, one in the emergency room and we have one in the clinic. And what the one in the emergency room does is helps to locate where nerves are. So if you're giving a patient a block or you're helping them, for people that have problems with their veins, to find the vein, you don't have to poke them quite as much. So it's a helpful tool. In the clinic, it's an abdominal ultrasound transducer. Kyle Byerly from radiology has helped to select one. They're a small transducer. It helps, it actually is connected to a iPad to help the doctors identify what they're looking for. And what it would do, one of the big things it would do is assist in what they're asking for when they send a patient down to radiology. They're more specific on what they're asking. The cost is about $8,000. So I'll have that. next meeting. Sorry that you didn't get that.
Cost for both is 8,000?
It's one unit.
It's 1 unit, okay.
I don't see that you need to put it off in my mind.
I can make some copies if anybody wanted to take a look at it. I apologize, I thought it was attached on the email.
It just wasn't a budgeted item. That's the reason we're bringing that. So, and we have sort of a rough number, $75,000 for our OR, but not for the clinic. So if we have tools that come up and a doctor says, I really need this, or something is broken, we have some leeway to work for that. We don't have that in the clinic. And we really do try to make sure, the doctors don't often ask for extra tools. So when they ask for that, we want to make sure they have the tools they need. But I apologize if you don't have that.
I feel like Chuck, for $8,000, if it's something that the doctors feel is necessary.
It's very helpful. I'm not sure that they would say it's absolutely necessary. When I talked to Dr. Gallagher about it, he said, yeah, it's really a good tool.
Well, I'd make a motion, we approve expenditure up to $8,000 for an ultrasound for the clinic.
Second.
Now, when I say 8,000, that's for the purchase. That doesn't include the service agreement. So there may be a couple, I don't remember how much it was in addition to that. But I'll bring that to you for the next meeting. So you have the exact number.
You want to amend your motion?
Yeah, I can amend it to include additional costs
For the service agreement.
Okay, any discussions? Been moved and seconded to approve the purchase of the handheld ultrasound for the, all those in favor?
Aye.
Passes unanimously. Okay, Wellness Center remodel cost.
So when we acquired the law office, there were some adjustments, some modifications that we're making to the building. We haven't started yet because we have to get permission from the inspectors. Turns out Lake County doesn't do the inspections for commercial buildings anymore, so they've been sent to Salem. We think we'll get the approvals back next week. And we have 2 bids until it gets approved. The estimated expense is about $18,000 for putting in, removing the wall, and we are making the waiting area enclosed. So in the way the law office opened, when you went in originally, it has a check-in cabinet or countertop, but in the wellness center, you want to have, from a HIPAA compliance standpoint, you want to have an enclosed area and then a door into that area. So we're doing that.
What was your cost estimate again, Joe?
Roughly $18,000 is what the estimate that we have. We got 2 estimates, but that would be the contractor that would go with. So our plan is to have that as soon as we can by August completed. It's been will be put into our bid package. Of course, if you haven't got a permit, you can't go until it has been permitted. So that's our plan.
Okay.
Because you asked what would be any kind of changes. We're also putting in the apartment building an air conditioning and heating system. And you may recall there's an office and then there's a 1-bedroom apartment. And Forest Service has expressed a great deal of interest in renting that space on a regular basis. That's what we're moving ahead with.
I'll make a motion that we increase that remodel cost for the
I will bring the information as soon as I have it. But that's the process that's going through.
Okay, do we need a motion to approve it until we get the leadership?
Probably would be appropriate to approve it, and then what I'll do is, as soon as I have that, I'll bring it to the firm. Does that work?
So we have a motion to approve the going forward on the wellness center remodel costs.
So moved up to $18,000.
Okay. $18,000. Do I hear a second? Oh, you moved. Okay, you second. Okay. Okay. She already moved once. Okay.
Oh, I'm sorry.
That's okay. Been moved and seconded to approve wellness center remodel costs up to $18,000. All those in favor? Aye. Okay, passes unanimously. Our vendor, the chip update.
Yes. Good morning. Good morning. I would like to reintroduce myself. My name is Arvinder Singh. I'm the Community Health Improvement Partnership Coordinator. And I wanted to share an update on the programs that the CHIP department has been involved with. Just making sure everybody got the handout. And so yeah, I'll start with the Living Well classes. Last year we received funds through the EOCCO to implement community and education on chronic conditions. Based on provider feedback, we trained 3 hospital staff members for teaching chronic pain and diabetes classes. Since November 2017, we have conducted 3 chronic pain workshops and 2 diabetes workshops. 55 patients and their family members had participated in the workshop so far. And we have also started a diabetes support group since May of 2018. And the diabetes support group classes occur bi-weekly. And till now, the feedback from the patients and the family has been pretty positive, and we want to continue more workshops through the mid of 2019. Next, I'll go to the Gatekeeper program. I'll give a brief description of what Gatekeeper program means. So this program trains community members to spot red flags in the senior population. And once a trained community member spots a red flag, or we call them gatekeepers, they contact the Aging and Disability Resource Connection in Klamath Falls hotline number. With the consent of the senior in need, the ADRC provides their help and assistance, either through referring them to the appropriate resource, or they put a personnel in charge to provide them help and support either through a phone call, or they meet them in person. So far we have trained 50 community members to be gatekeepers. Next, I will go on the Food Co update. So we are close to us completing our second year partnership between the CHIP department and the Food Co organization. So the Food Co service member works closely with the schools, and she teaches classes from K through 6, and she has been doing that on a weekly basis since the mid of 2017. She has also completed the Smarter Lunchroom certification trainings for the food service staff at both the schools. And since the start of the partnership between the CHIP department and the Food Co organization, we have built a fully functioning greenhouse garden at the Union Elementary School. And the work has started on building a Fremont school garden. In addition to that, the service member is also involved in field trips with the students. Recently, all the students from K through 6 were taken on a field trip to the Holland's dairy farms in Klamath Falls, so that they know the importance of consumption of milk. And also because the schools were going through an issue because there has been a change of the milk vendor at the schools, and the children do not like the flavor of the new milk. So field trip was planned, and I think the numbers are better now. Next, I'll go with the housing study. that the CHIP department is working on. So last year we conducted the community health needs assessment, and based on the community feedback, housing was one of the top needs that was identified. Since then I have been collaborating with several community partners to come up with a 3 or a 5-year plan to address this need. So one thing that we all decided upon, and including the Community Advisory Council, was the first step we wanted to take towards the housing challenge was to conduct a housing study in Lake County. So I'm excited to say that one of our community partners has gotten a grant where they're going to use the funds to conduct the housing study in 2018. The community partner is the South Central Oregon Economic Developmental District.
So what will happen with the housing study when it's complete?
So once we conduct the housing study, we'll get a clearer picture of what we need to do, what we need to implement in Lake County to address the housing study. Because for now we have many options to go about to address this need, but we didn't know where to start with. We need housing. We have shortage of housing for employees, for example. We have shortage of housing for people who don't have jobs, or people who are of a lower socioeconomic status. And we have several more problems with the housing situation in Lake County. So just to get a clearer idea of the picture of where to start with, the housing study will help us with that, and also will give us a clearer idea of how the community partners can come together and work on it, can contribute to the issue. So that's why we decided that we should conduct the housing study as the first step. Next, I will talk about the telemedicine update. So Lakeland District received more than $100,000 for the telemedicine program. So the telemedicine or telehealth idea is based upon so that a patient can visit or consult a provider through video chat, and it's especially useful for places which have shortage of providers or the access to the provider. So since the time we got the funds, our scope for the telemedicine project has changed. So we have changed the proposal and resubmitted it. Once we get the approval, we plan to set up equipment at 6 sites in Lake County. And these sites will improve access to the mental health and behavioral health services and needs in Lake County. The 6 sites are Lake Health District Wellness Center, Marius Building branch. Then we'll have one telemedicine equipment set up at the Lake District Wellness Center's new South office. We also want to set up at the Inner Code Family Services in Paisley. We'll be having a station at the Lake Health Clinic, at the Warner Creek Correctional Facility, and the Goose Lake Medical Services.
So they'll be connecting with like a psychologist at the other end?
Yes, so we have 2 options for certain sites such as the Goose Lake Medical Center and the Paisley. We have providers or mental health workers outside. Their station is based either in Eugene or in Bend. While for the other sites, we have our psychiatrists or mental health workers that will be through the use of telemedicine, the patients can visit them. They don't have to be there with them in person. So next update, we have also started a triathlon training series. So again, we have received EOCCO funds this year. The Community Advisory Council decided on the physical activity for children and adolescent incentive measure. We decided to focus on that incentive measure for 2018. So to address that incentive measure, we have started a youth triathlon training This is in partnership with the CHIP department and the OSU Extension Office. And we are training the kids for the home health and hospice triathlon that takes place every year in August. And so it's a 7-week course. We have classes once every week. 2 of the classes are complete, and till now we have had 70 kids that have participated in the trainings. Next, I want to just let you guys know about the Teen Health Fair. So we conducted a Teen Health Fair in November last year at the school gym, at the Daily Middle School gym. So we are planning to conduct teen health fairs again around in October, November window this year again. And we are going to be doing it at 2 sites. We are doing it at North Lake and the Lakeview School gym again. And this is again, we align this with the Adolescent Wellcare Incentive Measure that we have again, we are planning to focus on for 2018. And coming to the population health updates, so I've been working closely with the clinics in Lake County on various population health EOCCO measures that span from newborn babies to seniors. Some of them are, we provide diaper incentives for developmental screenings for newborns. We have incentives for prenatal and postpartum care. And we are also, we have been successful with the colorectal cancer screening incentive measure. And for the last 3 years, Lake Hill District has been providing free dental screenings at the schools for children. We'll be continuing that this year too. And the dental screenings are carried out in collaboration with Advantage Dental. And then I wanted to just give an update about the summer lunch program. This is the 2nd year that Lake Hill District is conducting the summer lunch program. Last year we served close to 2,400 lunches, and we also received the Western Region Award for Excellence for the summer food service program. And this year numbers are even better than last year. So far we have served close to 2,000 lunches, and we still have more than a month left for the summer lunch program.
You actually recruited Rotary to help, so.
Yes.
Not me, Rotary.
It's been a well-received and very valuable service for the community.
Okay, any questions for our vendor?
It's busy, I can see that.
Lot going on.
Thank you.
Okay. Thank you, sir. Okay. Next up is a nursing report. Teresa came in.
I did. So just a final update, the American Academy of Sleep Medicine awarded us with our final certificate for 5 years. So we're certified, which you all remember we went through a little hiatus while we waited to get the ability to continue to do sleep studies on Medicare and Medicaid patients until we could get that certification. So that is complete. We've had a couple changes. Our chemobiotherapy program is undergoing a change. The nurse that was doing that has had an emergency and has left Lakeview. So we're in the process of recruiting a new nurse for that program. So you might hear something about that. And also we've gone through some changes in the cardiopulmonary department with staff. One of our RTs left about 3 months ago, and our manager is now left. So, but we have a new RT onboarding, so she's just in the process of starting. So there's been a few changes in that. And the other thing that we're working on is expanding our nursing training for new graduates. We've always done some extensive orientation in some classes that we called rural nurse orientation, but we're expanding that to make it more like something they've been doing with success in Klamath at Sky Lakes. It's called a nurse residency program, so we're calling ours a rural nurse residency program, and it will take place over 3 months along with their clinical orientation. They'll also have extensive classroom orientation as well as some computer module training. So we expect to roll that out in October. So that is the final, I guess the final thing I wanted to report on, unless you guys had questions for me.
Your visit this August, you want to say anything about it? August visit? From Tamara?
Oh, sorry, thank you. I was thinking about Korea, actually. I'm going to Korea, but that's in September, so I couldn't think of what we were talking about. You can tell I was off today. So we've had really great response from the nursing program at OHSU, and we're continuing to work with the head of the nursing program there, and she'll be bringing the dean of the OHSU program from Portland down in August. So we're very excited to have her visit us and continue to talk about having rural nurse training with the OHSU program. So we're excited about that. She's really great to work with. We've had, we've had students there that have done their last part of their capstone experience. They've done that last piece here in our facility for a number of years, off and on, depending on if they were local nurses. But this looks like it'll be a little bigger than that. And they're looking at designating at least 2 slots to the Lakeview clinical training piece.
So when in August will she be coming down?
I can't remember the date, the 29th,
Yeah.
thanks.
Oh, so right around fair time.
Just before, yeah, this year. So, yeah, we're excited about that.
She just staying today?
Yes, they'll be coming over for the day.
She may stay longer if she sees how much rodeo we have.
Yeah. How great this is.
We don't know.
Okay. Thank you. Any other questions for Teresa? No? Okay. Gosh, we're down to the medical staff update. Doctor?
Jim,
We had no privileging.
I signed one yesterday.
Yeah, but that's not for the board, because you guys didn't meet in June.
Oh,
So.
nothing done.
But we will at the next meeting. We will have lots at the next meeting.
But it is nice to see your bright shining face in the
Well, I'm
audience.
sorry I'm late. I didn't know you started at 6:30.
Thank you.
Thought it was
My
7.
mistake.
It's Jim's mistake.
That was a brief report, thank you. CEO report, Harry.
Lots of things have been going on. Number one, Teresa didn't talk about what Abby has been doing, Abby Finetti, with her Stop the Bleed program. But as of a week or so ago, she run 11 classes, 157 people have gone through this Stop the Bleed program, of which 50 are under the age of 18. That's exceptional, and that's really, she's really passionate about it, and it's really a great thing for our community. Those of you that had a chance at Daily Days to see some of the information, or have been in the program, you'd know that there's a lot to know, and when you realize, I had the experience when she said, here we have a test. See how much pressure you could put on that to keep a puncture wound and to hold down it from bleeding out. And I could do it for about 5 seconds. Definitely need a tourniquet. So it's a really good thing. One of the things that we,
And she's willing to come and train the board at a board meeting if you guys would like
she
to do
is,
that.
and she's offered that, and we've talked about it, we just didn't set up a schedule so that all of you could participate, but we will do that, because I think it's a good thing, and same thing with the commissioners. who have
If you
expressed
drive a car,
willingness.
ride a horse, shoot guns, use knives. It's an important skill.
Knives in the kitchen?
Yeah, knives in the kitchen. Sorry, Charlie.
No problem.
One of the things that, when we talked about, this is really information. We started in the first quarter of this year where all the critical access hospitals and rural hospitals were paying a tax to help pay for the Medicaid program. And that started out at 4%. And the way that program works is the Hospital Association's organization called a prize calculates out what that dollar amount is, and then they take the money out of our checking account. The way that a prize has worked it out for all the hospitals, because we are paid for Medicaid services by capitation or by, in some cases, in fee-for-service others, they know pretty much how much we're going to use. So within 5 days, that money comes back to us. That rate has gone from 4% to 4.75%. Just telling you they have the right to go up to 6%. But in 2 weeks, Cheryl and I and Teresa for the day will be at the annual Oregon Association of Hospitals and Health Systems meeting. We'll have the opportunity on Wednesday to hear a debate between Governor Brown and Governor Hopeful Newt Bueller to see what they think about healthcare, because this is such an important issue. So that's one of the things that we participate in. We have been working on software, and I think you may have heard me talk about an electronic health record, how we're considering what we want to do with that. And we're started off with 4 options. Stay with CPSI, look at a company called Cerner, look at a company called eClinical. Dr. Grant, his clinic uses eClinical. And
Oh, I know.
I'm sorry, Athena, beg your pardon, my mistake. Athena, get them confused. We would, if we left CPSI, we would not continue using eClinical. So Athena, thank you, sorry about that. And then the third would be to look at Epic and the different flavors of Epic. We've had a presentation from CPSI, and we've had a presentation from Cerner. We're waiting to have presentations by end. So as we have more information, I'll bring that to you.
When do you expect to have a recommendation?
I had hoped by the end of the summer, some consultants that we've been talking to think that that's overly aggressive, that we have not really had an opportunity to think through what all that we want to do. So we're trying to temper that, make the best decision possible. But even if we were to go with CERN, as they described it, it would take a year from when we signed to when they would actually go live, that transition. So this is not a quick flip of the switch change. And we've had our physicians and practitioners involved, but in the preliminary parts of this, not everybody has time. But as we get closer and closer, I'm sure they'll be much more interested in looking at that. July 1 came, and we became responsible for public health. So it's been 5 days, 3 working days, and we're going through the process of merging our organizations. It's got lots to do, and so far, it's going okay. Can't tell you anything more about that. Daily Days, on June 23rd, we had a huge turnout. We had a lot, everyone here was involved, and we thank everyone. It was a well received and popular event. So those of you that were able to be here, it's just fun to see how many little, I didn't know how many little kids there were in Lakeview area. There were a lot. And even watching adults on that jousting, from the point to which of the adults from here were jousting. There were a lot of people having fun. Nobody went to the emergency. So.
Blackmail material on us.
So we have currently, today, our 340B program, which is the program that we get money from, we buy an expensive drug and then the manufacturer returns it to us at a lower price, restocks it. We're being audited today, and so far they haven't had any problems. But they were planning on being here for 2. I think they may have been leaving today after not being that big of a survey.
I think she left because they did not ask for the locking cabinet keys.
They buttoned it up today.
So that one, we'll find out if they had any problems, but it seemed to be going pretty well when I checked earlier. We had our audit from the Wellness Center. We had some findings. None of them are terribly critical. Most of them were in record keeping, and they said we're doing a lot better, but here's some more ways to get that. We still have not had our long-term care survey. We were expecting it from November on. It still has not occurred. So we knew it wasn't going to be this week. It's possible it could be Monday. We don't know. And they'll tell us when they show up. So Maryville and Larry have been working hard to be prepared for whatever the survey might be ready for. Larry's getting ready for a survey for the assisted living. We're estimating in November or October?
I'm guessing September or October.
Okay, September or October. Probably before the snow, or the threat of snow. Because after all, no one can drive in that from the other side of the mountains. So we'll see on that. Construction for the clinics is progressing well. They're still on their target date of being able to be completed by Christmas, or they're saying the end of the year, but don't anticipate they'll be doing a lot in the Christmas to New Year's time period. They're finished up, they're now hanging sheetrock in the specialty clinic, and they were finishing up framing in the old portion of the Lake Health Clinic. So things are moving along. The corridor, as you've seen, has been reopened. So it's moving along. Soon we'll start seeing more of the outside being done, where for Dr. Graham's office, for example, they'll put in all new windows, make them energy efficient and match the other windows. They'll change the siding, take off the concrete off the roof and put on the same asphalt roof that we have on his building. So it's not his, but the building that he's in. So other than that, any questions? I have questions. I can tell you about, if you want, we have a couple of physician practitioners changes that are going on. We hired Kathy Thompson. She is a PA from North Lake and started a week and a half ago, or was it a week ago?
The 25th of June.
25th of June. So she's going to be seeing patients both in the clinic as well as we'll be expanding some of our services in the public health. Nurse practitioner been coming over from Clement to see patients that are clients in public health, so she'll be doing some of that. We have a temporary or a locum practitioner. His name is Rikpa
Shunya.
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 Thank you. And Rikpa is a psychiatric nurse practitioner. And he's been, he's here to work with us for about 3 months. If all goes well, and we like him, he likes us, then we could extend that. based on the psychiatrists that we've talked to about creating better collaboration between mental health and physical health, they estimate that if we're seeing 400 clients in mental health, we could readily handle having a psychiatric nurse practitioner help in the medication management. What's been happening is that our practitioners, Dr. Graham and all the other practitioners, have been managing that medication. This might help in their time, because their time is really stressed, to help manage those patients. So we'll see how that progresses. Dr. Emery Chang is a surgeon, and he is coming on the 9th, I believe it is, of July to, pardon me? Monday. So he'll be here. He's the doctor that you may recall I talked about. He's been working 2 weeks in Burns and then 2 weeks in Washington. And his arrangement with the Harding Hospital in Burns has changed. And he's looking for another location. He's coming on the 9th because that matches when Dr. Bradley is here, so that they can talk. They've talked on the phone many times, but Dr. Bradley thinks this would be a real value to us, especially as he's here 1 week a month. He believes, as do our practitioners, that we could accommodate more surgery if we have a practitioner willing to spend more time. So we'll see how that goes. Dr. Breck, who many of you met a week and a half ago. I talked to her today. She's pretty concerned a little bit about the drive, but we'll see. She's the orthopedic surgeon that we met with. She came up to meet when Dr. Mary Skrinsky was here, and actually sat in on was in one of the surgeries to see what our suite is like in our clinics. She was very, very impressed. So thank you, those that were able to be at that meeting. She was very impressed. I think that describes it. Well, as much as I can think of right now. Any questions for any of us? We have lots of people here.
Comments, questions? You got a whole crew here to answer your questions. No? Okay. Well, with that, we'll adjourn and go into executive session, ORS 192-660, bracket 2, bracket A, personnel, bracket C, medical staff, bracket H, legal.